Fundamental question 1. The most appropriate person to take care of the clients being discharged who need teaching reinforced would be the 1. RN, 2. LPN, 3. CAN, 4. UAP. Correct answer 2. LPN. 2. The RN asked the nursing assistant to wash the client's hair. As part of her assignment, the RN will be help the NA to understand that washing the client's hair will 1. Raise self-esteem, 2. Make her feel better, 3. Improve her physical condition, 4. Make her more responsible. The correct answer 1. Raise her self-esteem. 3. A nurse is performing an admission assessment on a client admitted to the hospital with a diagnosis of fever unknown origin. The nurse performs intervention based on the Nurse Practice Act when the nurse 1. Enters the information the client's record, 2. Write the information on the worksheet, 3. Inform the supervisor of the client's vital signs, 4. Tells another nurse that the client has a high fever. The correct answer is 1. Enters the information on the client's record. 4. A nurse is caring for a client who has wrist restraints applied. Which nursing intervention would receive highest priority with regards to the wrist restraints? 1. Providing range of motion exercise to the wrist. 2. Removing the restraints periodically per agent's guidelines. 3. Applying lotion on the skin under the restraints. 4. Assessing color, sensation and pulses distal to the restraints. The correct answer is 4. Assessing color, sensation and pulses distal to the restraints. 5. The client who is most critical and should be assessed by the RN is the 1. Diabetic client being discharged and requiring discharge teaching. 2. Cardiac client with a history of ventricular tachycardia. 3. Client requiring IV push medication. 4. Comatose terminally ill client. The correct answer is 2. Cardiac client with a history of ventricular tachycardia. 6. The RN is very short-staffed because 2 people did not show up for work. Of the following 4 clients, which one would the RN take care first? 1. A client just admitted with acute abdominal pain and possible cholecystitis. 2. A client with nephrotic syndrome with increasing edema, hourly urine checks and vital signs. 3. A confused client telling because he is in soft restraints cannot get out of the bed. 4. A head injury client was just admitted to the unit. The correct answer is 4. A head injury client who was just admitted to the client unit. 7. The civil rights of the clients would not be jeopardized in which of the following situation? 1. Trying to forcibly detail a client who may suffer great harm by leaving the hospital. 2. Giving emergency medical care to the client without his or her consent, the consent of the family. 3. Giving psychiatric client letters addressed to the President of the United States to his physician. 4. Giving the client's insurance broker access to his chart. The correct answer is 2. Giving emergency medical care to the client without his or her consent or the consent of the family. 8. The RN has full workload and must reassign some of her clients to the UAP. The most appropriate client reassign the UAP would be an 1. Client just returning from recovery room following colostomy surgery. 2. Cerebrovascular assistant client who has been hospitalized for 2 days. 3. Oncology client who in severe pain controlled by epidural anesthesia. 4. Newly admitted the client with suspected pancreatitis. The correct answer is 2. Cerebrovascular assistant client who has been hospitalized for 2 days.